Hello, welcome everyone. Today we are doing another video in the Eye Opener series. And this is the video series where we interview specialists in different areas. The idea is to give some information for our young medical students about different specialties in medicine and surgery. This will greatly help them to decide about a career in that particular specialty. So today, I've got a great friend of mine, Dr. Raj Ganesh, who is an associate professor in Madras Medical College. We went to medical college together. Now, Raj is very much interested in teaching, and he is very good at interacting with medical students. And he is very keen to answer many questions, which I have got personally, as well as I'm sure you will have before taking up a career in orthopedics. Without further delay, let's welcome Dr. Raj Ganesh so that we can get some insight into the field of orthopedics. Hello, Dr. Raj Ganesh. Hello. Are you there?
Hello, Dr. Sandil. Hello.
Hello,
Yes.
hello, hello. Thanks for coming today to participate in this interview series. Now, I've got a few questions for you. Now, this will be very useful for our medical students. So is it okay for us to start the questions?
Yes, Dr. Sandil, it's my pleasure.
Thank you. Thank you very much. So if I'm a medical student, Raj, and if I'm thinking about a career in orthopedics, what would you say about your specialty, which will persuade me to take up a career in orthopedics?
Yes, Sandil. Orthopedics is an interesting field as such, Sandil. It deals with a wide spectrum of illnesses, say starting from everyday trauma, be it an road traffic accident or a domestic injury, and some spinal injuries, arthroscopy, for example, joint replacement. So it covers a wide spectrum of illnesses to start with. And orthopedics provides a platform in which there is a constant scope for upgradation, be it an implant upgradation like in modifications in the implant design, or there is an upgradation in the surgical technique. Say in my career spanning 15 years, we have gone from open reductions to minimal access surgeries now. So it provides a platform in which there is a constant scope for improvement. And I think these are the essential features why orthopedics is preferred by the medical students. And students who are inclined to trauma emergencies, those students who are more interested in biomechanics, and the students who have an inherent architectural abilities, they prefer orthopedics so much. And to summarize, the satisfaction of getting a patient out of bed to walk, that is an important thing in orthopedics. You see a trauma patient, you treat the patient, and you make the patient mobile. So that itself gives a satisfaction in orthopedics. And last but not the least, it meets your financial expectations, or to say that it more than meets your financial expectations. Yeah, these things are the preferred things to take up orthopedics.
Excellent, Dr. Raj. Excellent. I mean, it's really a very fascinating area in medicine, or rather surgery, which the students can look up to for their future as their career. But at this point, let me ask you, I know that there are quite a lot of positives about your field. There also must be some challenges in your field. Have you ever met with those challenges which has made you regret taking this field? Or if you have never regretted taking orthopedics, Would you tell us a little bit about the problematic areas within your field which the students must consider before taking up a career?
Yes, Dr. Sandil, good that you asked that question to clarify all the doubts. It's an interesting question as well. There are no regrets on my part, but I too agree there are certain challenges which you face when you take up orthopedics. The first and foremost will be until you take up any subspecialty in orthopedics. In your early part of your career, when you are new to orthopedics practice, you are expected for any emergencies 24/7. So it may compromise a part of your personal time as well. So that thing you should be ready to face until you go up in your career. So that is the first point, which is a thing to be considered in orthopedics. The second and important thing is the litigations are more common in orthopedics than any other surgical specialties, because the complications in orthopedics are chronic, like the complications like infections or implant failures, which is a part of the treatment, but these things may get chronic and it may be prone for litigations. And these complications are too obvious in imagings. So that is also an important thing, the reason because litigations are very common in orthopedics. And the third thing will be the infrastructure and the equipment cost to create a basic orthopedic setup is higher. So that is one of the important challenges which we face in orthopedics.
Thank you, Dr. Raj. Thank you for sharing this detailed information. I mean, I think people should also know about the challenges as well as the positives. And I think there are mostly positives here anyway. And this is a very good field for medical students to consider. Now, how should a medical student prepare himself or herself to become a very good orthopedic doctor?
Yes, Dr. Sandal. Yes, the preparations, if you say, it should start from the clinical postings. When you are into your clinical postings and your internship, what you can do is you can start observing the emergency room procedures, the trauma emergency room procedures, the first aids which are being done for orthopedics, the plaster applications which are done in an emergency room procedures, the minor close reductions, and some immobilization techniques what we use for orthopedics. You can just give a visit to the emergency room and you can just observe. The advantage is you will get to know whether you're getting interested or you're getting inclined to orthopedics. So in that way, you can get exposed to the environment where, and one more thing is, you can interact with patients, orthopedic patients who have undergone any procedures, and this will kindle your interest in getting up to orthopedics. I think that will be useful for the clinical students and the interns to get to know their love towards orthopedics.
Thank you. Thank you very much, Dr. Raj. This information has been very useful. I hope this interview is also very useful for our medical students who are watching this program. Now, one thing which I wanted to ask you is that if the students come up with some questions in the future, would you be able to answer those questions if that's okay with you?
I'll be glad to answer the questions, Dr. Sendil. It's my pleasure.
Oh, thank you. Thank you very much for your time today, and I hope we will meet again soon. Thank you.
Nice meeting you, Sendil.
Thank
Thank
you.
you.